Today we will discuss about ARDS. The definition of ARDS is the sudden and progressive form of acute respiratory failure in which the alveolar capillary membrane becomes damaged and more permeable to intravascular fluid, resulting in severe dyspnea, hypoxemia, and diffuse pulmonary infiltrates. It's not only included the intrapulmonary pathology, it's also included the extrapulmonary like heart and other causes also. So we will move to next like etiology and risk factor. The direct lung injury common causes are aspiration of gastric content and other substances, viral bacterial pneumonia, chest trauma, embolisms like fat, air, and amniotic fluid, inhalation of toxic substances, near drowning, oxygen toxicity, and radiation pneumonitis, and this all causes the lung injury. And the indirect lung injury is sepsis that goes into the bloodstream that directly spread into the whole body. So next is severe traumatic injury, acute pancreatitis, anaphylaxis, prolonged cardiopulmonary bypass surgery, dissemination intravascular coagulation, multiple blood transfusion, narcotic drug overdose, and severe head injury, shock, massive blood transfusion, etc. Next to move with clinical manifestation like early sign and symptom, restlessness. Patient will come with restlessness, dyspnea, low blood pressure, confusion state, and extreme tiredness. Since patients' behaviors like mood swing, disorientation, changes in LOC, patient may be loss of conscious state. If the pneumonia is causing ARDS, then the client or patient may have fever and cough. These all are the early sign and symptom of ARDS, and later it causes like severe difficulty in breathing, like labored or slow, rapid breathing, shortness of breath, tachycardia, and cyanosis like bluish skin, lips, and nails. These all are symptoms of cyanosis. Thick, thick frothy sputum, metabolic acidosis, and abnormal breath sound like crackles. It will auscultate. It will only get from auscultation. PA carbon dioxide and respiratory alkalosis, PaO2 reduced. These all are late sign and symptoms. Next, diagnostic and evaluation. The history of all above symptoms we can diagnose the actual cause, and on physical examination all auscultation reveals abnormal breath sound, and first test done are arterial ABG, blood test, chest x-ray. In chest x-ray we will see the opacity, and sputum culture and analysis, CT scan, echocardiogram, etc. we can done. Complications are nosomial pneumonia, bronchotrauma, renal failure, and other complication is like oxygen toxicity, stress ulcer, tracheal ulcer, the blood clots that leads to deep pain, thrombosis, and lastly pulmonary embolisms. So we will move to next topic like management. That is most important one. Person with ARDS also are hospitalized and require treatment of intensive care unit. We always prefer to ICU. No specific therapy of ARDS exists. Supportive measurement like oxygen, supplementary oxygen, mechanical respirator positioning strategies like turn the patient from spine to prone, and the position is lateral rotation therapy, and fluid therapy will manage from through fluid therapy. And next, medical management with medications like antibiotics, anti-inflammatory drugs such as corticosteroids, diuretics to reduce the edema, external fluid, drugs that raise to blood pressure because we will have low blood pressure. So we always intention to increase its blood pressure, the patient's blood pressures, anti-anxiety that also leads to ARDS, muscle relaxation, inhaled drug like bronchodilator that leads to bronchodilation and cause the complication reduced.